being manufactured too rapidly at a very high speed, you see, and then instead of making a thumb, it ending making a tumor here, making here a swelling, another swelling is coming here. So in order for you to get rid of this, you need, if you want to kill it, remember it is your own cell. If you want to kill it, you need to understand that there are good cells and bad cells in here. If you want to kill it, you have to have a way of killing them. Okay, another thing, the problem with cancer, it's when they start, they don't have an alarm. So you can say, for example, I have done something. I'll go to that part on the causes. I'll go to the causes. I have done something today, and then that something has caused my cells to reproduce in a way that it was not supposed to do so. But if I want to kill it, I will have to understand that they are there. But then this process could have started happening maybe 5 or 10 years ago, but I don't know about it. So by the time I notice that something is wrong, maybe it's too late. See, that is the problem with cancer. At first, they don't have any sign. They're not itchy. They don't produce pain. You see nothing. You see like everything is fine. But later on, you came to realize and see that you already have a cancer. And there now, you see those fancy words, oh, it is stage 1, stage 2, stage 3, or whatever. But it's just our ways of naming that this cancer is beginning, it is proceeding, now it is bad, and it is very bad. So yeah, that is why it is a problem. If you want to kill it, you will be killing also your own cells. That is another challenge. I think in that way maybe I'm understood.
Yeah, of course, I think you are well understood. For those that are just joining us, we are here. We are having a discussion with a doctor from Tanzania. We are talking about cancer. Kwamene mukungoti panga join kumene tikucheza ndi doctor ochokera ku Tanzania, ndipo msiku la lero topic yathu tukamba za cancer. Tufuna tiziwe kuti kodi cancer ndi chani, cancer imayamba bwanji, komanso ndi zinthu ziti zimene tikuyenera kuti tizipewe, kuti mwina ngati pali zinthu zina zake zimene mu generation yathu zimayambisa cancer zoti ndizopeweka tikozanso kuzipewa. So musachoke, mukhale pomwepa chifukwa conversation iyi ndiyofunikira kwa ine, kwa inu, komanso wina aliyense amene akumvera. So doctor, maybe to my second question. Yes. I think we've seen people who have suffered from it, and it's not always the same, meaning there are different types of cancer. So we just wanted you to go broad now to explain to us the different types of cancer.
Okay. So thank you very much. So simply putting it into perspective, I'll just say there are over 200 types of cancers that we have graded medically, but I'm not going to talk about those. I just want us to concentrate into two things. There are cancers which are solid cancers, that they have a swelling that you can see. So there is a swelling there where the cells have piled and together, and they have formed something, a mass, a swelling. And then there are liquid cancers. So these, for example, an example of solid cancers are, for example, of the breast tumor. You see, you have a breast mass or a breast swelling, and then that swelling, if you go to the hospital, they will tell you maybe this is we suspect it is a carcinogenic or it's cancerous. Okay, is just like that. Or you can have a swelling in your tummy, maybe in your skin, or you can have a swelling in your whatever organ. So that will be a cancer that is solid. And another type of cancer are cancers which are liquid type. Okay, so these ones, they are cancer, yes, but for an example of the machine that I explained before, they are the cancers that they will go around, they will move So, for example, these cancers are, for example, lymphoma, which gets to your blood, and then the blood cells which are made are bad cells, and then they will go around to your body. Wherever they go, then they won't do the job that they were supposed to do, which is to carry, for example, oxygen, to carry air. So these cancers then they will go right there. So just to put into perspective, we will just need to understand that there are two types. There are cancers which are solid, and there are others which are floating. They are like liquid. Yes, and right there, I'll just say all cancers have the same mechanism. A good cell is destroyed by something which we will speak is causing these cells to be like that, and then instead of your body producing good cells, it's making bad cells. Those cells, they can either go and collect themselves as a swelling, that will be a solid, or they can be moving like in your blood, like a blood, a lymph. Maybe you can also translate that. Thank you.
Okay, before I go there, I just wanted to know, I just wanted us to go on the two first. I would want to understand. Starting from the one you said, they are more like solid ones. I think recently there is that, I don't know how to call it, but it comes around the jaw. The swelling comes
Yes.
around the jaw. Yeah, and I think recently we haven't had seen it in the past like the way we are seeing it right now. It has so much spread across the world. I just wanted to know why that type of cancer has spread so much around the world right now, and why is it that it's causing a lot of also havoc around the world right now.
Okay, so to put into perspective, I think you are talking about the cancer that can happen around the jaw, around here. You mean, right?
Yeah.
So over there we can have so many cancers that can affect a single part. So in order for our viewers to understand, and so that we don't put them into a very complex thing, so every organ can have a cancer. So if you have a cancer of a jaw, it can either be a skin or it can either be a bone inside it. Okay, if you have a cancer in your nose, then it can either be in your soft part or at the hard part of the nose. If you have a cancer of your eye, then that will also be another cancer, and and everywhere you have that cancer, it has a name. So in order for us to understand, at the jaw, okay, that you have asked, you can have a cancer of the bone that is the bone that is supporting your cheeks and your mouth, okay. Oh, and that bone is also connected with your throat. And that way it can when you have that cancer, then it can affect other things. So when you have that particular cancer, and why it is maybe a problem, it's because if you have that cancer, it will compress your throat. So you cannot, you reach a point that you cannot swallow, or even because behind the throat there is a windpipe which helps you pass the air to your lungs. Then it can also compress the windpipe, and that way you won't be able to breathe. So it is a concern because when it becomes bigger, then a person cannot eat, they cannot swallow, and sometimes they are not able to breathe. So they will get complication, and they might die from those complications apart from the cancer itself. And maybe it is a concern because you see it, you see, and it is the same as any other cancer. It will start by the causes that we will discuss, and later on, when it is late diagnosed, then that mass that I've just explained, the swelling has increased, and then now you are seeing that swelling outside. It can be at the jaws, it can be now at anywhere. At this point, we are talking about the swelling around the jaw. Was I clear?
Okay, yeah, of course. Before I go to the next question, kwa anthu amene mukungotewa nga John kumene, mwina ndingonenapo ziwiri zitatu zokha in short. I think amakambapo kunena kuti cancer maujeni amene anapeza ndi ambiri almost 200. Komano pali mitundu iwiri imene ina ndi liquid, ina ndi solid. Liquid ndi zamazi, solid tikhoza onera kuti zowuma. So za solid izo ndi zimene mumaona lese anthu atupa uku kuchibwano uku anthu amene tikuwaona aja. Za liquid nde kuti zikhoza kukhalanso mwina za magazi and all that. So basically nde kuti mitundu iwiri yeniyeni imene ilipo ya cancer, pa mitundu yeniyeni imene ilipo ya cancer ndi iwiri. Komano pa mitundu iwiripo paliso zambirimbiri zimatenda zambirimbiri zimene zili zophatikizirika imene ili over 200. So I just wanted to ask, I'm still on the Joan because here in Malawi, the people that I've come across or the news that I've heard of people who had that, most of them had gone to the hospital to remove a teeth. Yeah, to remove a teeth. After that, it never healed when they removed the teeth. As the result, it started the place started swelling up. Yeah, up until now, if they go to the hospital, they will just give them, some painkillers and all that. They go back home later to realize it's cancer. So now my question is, was the cancer already there, but the person didn't know they have cancer? Or now is the complication of the person removing the tooth that made the person now to have the cancer?
Okay, thank you very much. So what now you have explained it, I think I understand. Are those people small children or like an adult?
And in most cases, adults.
Adults.
Yeah.
Okay.
Yeah.
Okay. So we have these cancers which are called the lymphoma, and I don't want to use these medical jargons because they usually confuse people. But I will explain to the scenario that you've just presented. So the fact that that person had a toothache, it means they had something. Okay. So I'll just go. Let's just go back to you and me, or anybody who does not have a cancer. Your mouth has millions of microbes. Okay, and these microbes are not a problem. But when you have cut yourself, these microbes, they can enter the bloodstream and then they can cause different diseases out there. And in this case, they can infect these microbes. They can infect the tooth or the gums. Okay, and then when that happens, you'll go to the hospital, of course, to get treated. So normally, if you don't have a problem, we just give you antibiotics, the medicine to kill the parasites, okay, the bacteria, and then you'll be fine after some time. But when you see that at the hospital they are telling you that this wound that you have is not healing, it means that there's a problem, okay, that you're also going to discuss. So that means you had a problem. As I spoke, you had something in your jaw for some time. That thing has accumulated itself, has changed, and because it has changed, it is then now pushing your teeth. So you'll feel like the teeth are aching. And at that moment when you go to the hospital, you take out your tooth, but then the place where the wound won't heal because at that place, because it had changed, the nature had changed, the cells that are there are not responding the same way as you would have responded. I mean, the normal cells would have responded, because we talked before that the cancer cells, they do not listen. Even if you press the stop button, they do not listen. They keep on reproducing and reproducing and reproducing. So there comes the biggest problem that we have right now, that most people, they will go to the hospital late. So that explains your scenario, that these people, they had a problem before and it has been there, it has developed. Maybe they had seen other symptoms, but they ignored. By the time they went to the hospital, it was already at the higher stages.
Thank you so much. I will later give other people time to also ask you questions, but I now want to ask you a personal question. I just want to know, we go now. I don't know if we now go to the wicked side. I think there is the cancer of the blood you call leukemia, right?
Yes.
I just wanted to know, can one, be sick? You just have some fevers. Sometimes as a woman, you on your period days, you have lots of periods coming down and all that. You go to the hospital, they just give you medication that you'll be okay without giving proper tests. Days later, maybe after some 6 months, either they diagnose you maybe 4 days before, and then maybe after they give you a diagnosis today, 4 days later you end up dying. My question now basically goes to with leukemia, can someone die without being diagnosed and then the person is just okay?
Okay. Yes. So in order for our followers to understand, so when we are saying leukemia, simply put, we are saying that this is a cancer of blood in a very simple terms. We say this is a cancer of blood, but it is your blood and my blood is produced by our bone marrows and our liver. Okay, there is where they are being produced. So as I explained before, it is also the same mechanism that your body will command your cells to produce healthy cells, the red cells and the white cells. Okay, and then now these cells, when they are produced by your body, they will help transport the air. Okay, and the factory at this point, it is your bone marrow. It is around your bones. Okay, but when you have these cells, if they are corrupted, they cannot listen. Then they'll start producing bad cells. Okay, and if they produce bad cells, that means the cells that are being produced in your blood, you have the white cells, which they help you fight diseases and support you every time you get an attack, because we are constantly getting attacks. And then you have the red cells, which they carry your oxygen, okay, and help you move and everything. So at this point, when you have the leukemia, then the white cells that they are supposed to protect you from diseases, they get that problem. So you understand that? Yeah. So that way, if it happens, that means even if you get sick, they will no longer be cells that can help you fight the diseases. I hope at that point I am understood, and maybe you can help me, and you can tell me if I'm understood, so that we can move to your question.
Yeah, it's understood. You can move.
Okay. Yes. So your question was, could you remind me your question?
Okay, my question was, can someone end up dying from it without being diagnosed? You can move, your body is okay, but later die, and then they say, okay, you had leukemia.
Yes. So sometimes the problem can happen when you are young, and sometimes it can develop when you are an adult. And by the time your body will, when you get cancer, your body will try its best to fight and fight and fight. And because of our circumstance, I'll just assume that Malawi is also like Tanzania or any other part of the world where we don't go to hospital until when we have pain. Pain is the thing that takes us, most of us, to the hospital. But if you don't have pain, then you don't go to the hospital. So what happens is this person could have had this problem for a while. Maybe they experience that they cannot breathe well or something. Maybe they get sick very often, but they ignore, and then they'll just go maybe to these primary health care. Okay, we call them zahanati in Swahili, or the healthcare, the primary healthcare. And then over there, when you go there, they'll just give you pills that you are sick. They give you pills. By the time the problem is bigger, then you go to a bigger hospital. It is too late. And then, because, as I said, these cells, they help you fight with the infection, then you will die because of the infection. So the leukemia itself won't kill you, but the infection enters, and then your body cannot fight it, and then you die. And then later they come to understand that you had a leukemia because your body could not fight the disease. Any disease, it could be a cough, could be a viral. So anything that can enter cannot be fought because your body didn't, your cells that are supposed to fight, they are the one that they got sick.
All right. Thank you so much. I think I've understood you clearly. I'm going to give a chance to other people also to ask you questions. Tikupereka mpata kwa anthu kuti mufunse mafunso anu. I think at this point sindilesa munthu kufunsa mafunso awiri kapena angapo, but then what I would do is koyambirirako ndizikupasani mwayi kuti mungofunsa kaye funso limodzi, and then kuti anthu enaso afunse kaye. If you have more questions nde kuti muzapitiriza ndikufunsaso. So koyambirirako, I'm giving you a chance kuti muzifunsa funso kwa amene mungoti panga join kumene. Mind you, tukambirana nkhani ya cancer, kudziwa kuti kodi cancer ndi chani, nchifukwa chani panopa cancer ikutizunza kwambiri makamaka mu generation yathu iyi ndi all that. Ndengati muli ndi mafunso, if you know kuti simungapange form funso la chizungu bwinobwino, ndetu mukhoza kulemba nchichewa mu comment section, nde kuti funso lanu lizapangidwa translate ndi kuwerengedwa mchizungu. Akakuyankhanisoni nderi ngati mwapanga understand imene akuyankhirani munena, ngati simunapange understand nde kuti so zapangidwa so translate. So right now let me start with I don't know, Aaron, if you're there. If you have a question, I can start with you.
Sorry, are we going to discuss the causes or after we take questions?
Okay, I just want you to I just want people to give questions, and then after that we go into the causes. Yeah, because I want people not to forget. I'm sorry, I was now going back to my language.
It's okay.
Okay.
It's okay.
So, thank you very much, Doctor, for the presentation and for your presence. For me, I've heard the things you've said, and maybe I have no questions. So I would rather give the time to someone who has questions. Thank you.
All right. Thank you so much. Wanda, can you go with your question, please?
Okay, should I ask a question what he was talking about or another question?
Okay, if you're okay with asking what he has talked about, it's okay. If you also have another question, you can ask it still. It's okay. But later, after the first round of questions, we'll now go into the causes.
Okay, maybe before I forget, I'll ask about something maybe like about a smear test. I would like to know what ages, like from what age should someone go for those tests, the smear test? From what ages should they go for a test? And how long should you go for a test? Thank you.
Over to you, sir. Your microphone is off.
Sorry. Thank you very much for reminding. Sometimes I forget. Thank you very much. I think you can hear me right now.
Yeah, I
can. Okay. Thank you. So, in order for me to answer her question on smear test, because she now went from we have understood what is cancer, and now we have not discussed the causes yet, but she asked about the smear test. Can we hold this question later, or I can just answer right now?
Okay, then let's just hold it, because I just wanted people to ask questions. I didn't want us to go broad and then maybe people will forget the questions. So I want people to ask questions on the things that you've said. If they have understood you,
yes.
If they have understood, it's okay. But if there's something that they haven't understood yet, they can ask questions regarding that. So I think we can hold that one. And then go with the other people to ask questions on what we have already discussed, and then we go into the causes.
Yes.
Okay,
After
Sherry,
discussing the causes, we'll go to the tests. Yes.
Yeah.
It will be very easy to understand.
Yeah, that way. Yeah. Sherry, if you have a question, please.
Okay. I think my question could be like the one for one shadow, like when you want to do pap smear, it ranges from which age to which age.
Okay. Then if that's the case, if that's the question, then that put us at a place whereby you have to with your question. If there is anybody in the box that has a question regarding what we've already talked about, let me know in the comment section. But if we are okay, then let's just go to the next step, where the causes.
Okay. So I didn't answer your question, and I will answer it later after understanding. And I want to put it in a very simple language that we can understand. So as I said, your cells are good cells until they misbehave. So something must get to them. There is why we are discussing here today. So you will see that over 90%, if you have 10 people with cancer, 9 people, they will have developed cancer because of the things that are come from outside. They are not in them. So there should be something that can cause that change. So the first cause which can cause the cancer is the lifestyle, or we call these environmental factors. And here I'll talk about the chemicals that everybody sometimes we speak, oh, do not do this, do not do that, because of the chemicals. So here we have the biggest culprit, which is the tobacco smoke. So smoking, any kind of smoking is not good. So smoking tobacco, smoking shisha, some other people they'll go and smoke bangi or etc. But now at this point we'll talk about the tobacco smoking. That people they do smoke, or you can say I don't smoke, but maybe your relative is smoking, maybe your partner is smoking. Then when they smoke, they will inhale a little amount of smoke, and then when they give out the smoke, you who will be receiving that smoke will be affected more than them. And here is where we say, if you see someone is smoking, you can just politely ask them, excuse me, I'm not well, could you please stop smoking, or could you please go a little bit further from me if you see someone is smoking. Okay, another thing in the chemical part is alcohol. We know that people are drinking alcohol, and there's arguments. Even we've started this session with prayers and everything. They're saying that the Bible does not tell you not to drink, but they tell you not to over drink. Yes, and that is the case actually, because excess alcohol is a problem. So an alcohol is a chemical. So what it does, it's when you drink an alcohol, you see that this person who drinks alcohol, they will start smelling that alcohol. That means the alcohol will be coming out as air. Okay, so that alcohol, when it enters in your body, it produces a very toxic chemical, and that chemical will damage your DNA, will damage your cells. So the DNA is the information that help your cell make something. If it's a finger, then the DNA of your finger, they are telling your cells to make cells of the finger. So if it is damaged, then they will make more cells that are not supposed to be there, as I explained. Okay, and then we have another industrial chemicals. Here, if you are exposed too much to the chemicals, for example, the painting, if you expose it too much, if you are a painter, you expose maybe over 10, 20 years, etc., you can get that problem. So the first thing is the chemicals. The second thing that can cause cancers are the physical causes. Now, here we'll talk about the radiation. You'll see that people are telling you, this sun is too hot, you can get skin cancer or something, but also maybe X-ray, don't go to X-rays, you can get cancer, or maybe there are other rays which you cannot see, etc. So they are right in that way. Even the sun that we like so much, when it is abused, if you get to the sun too much and it is too high, it can also damage your cells and you can get skin cancer if you are not careful. But also there are other things. For example, if you are getting radiation like X-rays, as I explained, if you are getting X-rays, for example, previous we had X-rays that were very strong. So if you have an X-ray, you have to make sure that you don't overexpose yourself. The CT scans that we use at the hospital to see what is wrong with your body inside, if they are used too much, they have a problem. Even the nuclear radiation, for example, what happened in Japan, that can also cause you to get cancer. Other things. Now, I want to talk about causes here, and I will also talk about what she asked about pap smear. So we have biological causes. So we have some other things, for example, that they don't necessarily cause cancer, but them being there, they make your body cells to change and become cancerous. Here, I'll talk first about the virus infection. We know this virus called human papilloma virus, HPV, and to the point that right now it is spoken everywhere that when you get the HPV infection, if it is not treated, later you can get cancer. And which cancer? You can get the cancer of the cervix for women. You can get the cancer of the throat for both women and men, or you can get a cancer of a part that HPV virus has stayed there. So what happens is the virus, the HPV virus, it gets to your body from someone. So let's say you have a husband who is having multiple sexual partner, and then that another partner has HPV virus. Then when you have sex with your husband, he can transmit the HPV virus to you. And what it does is the HPV virus will get to your innermost, and then they will sit at the neck of your womb. I think if I say womb, it's easier, where the baby are being carried. Okay, that womb that carries the baby. Okay, so there is a neck, there is an entrance of that neck, of that womb. So that virus will go and sit there. When it sits there, it can sit there for so many years without you noticing, without even knowing that you have it. But what it does when it is sitting there, it is producing some chemicals. The virus itself, it produces the enzymes. Let's call them chemicals. Then those chemicals, they will slowly starting to change the cells around that virus. See? So these cells, instead of producing the normal cells, they'll start changing and produce something else. The cells will start changing. So if you don't go for screening, that we'll also talk about the smears, the pap smear. If you don't go for screening, then those cells, they will change into cancer. but it will take at least 8 years to people who don't have good immunity. But for those who have good immunity, up to 20 years, they can sit there without doing anything, and then after 20 years, then you can get a problem. And here I want to speak while I'm answering the question now. When you have that HPV, the virus that can cause this cancer of the cervix, or the neck of the womb, we call it cervix, okay? When you have that HPV, you just need to go for, in Tanzania, we have already adopted, bigger technology. I was talking to Malawi colleagues. I think you have also started screening for HPV, where you will go, in Tanzania, we used to go for annual and then 3 years. But right now, with the correct technique, which is the HPV DNA screening, now you can go after every 5 years. So what we are saying is, any woman who is sexually active, if you are sexually active, you have started having sex, you will need to go to the healthcare workers or to the hospital after every 5 years. If they're using the HPV DNA screening, which is the best technology right now, you'll have to go there after every 5 years to get checked. Okay, so that they will do the smear, they will do the screening to see if your cells have symptoms or have signs of they have changed, or they have signs of cancer. So that is what smear is. You'll have to go there, and then they will check every 5 years. But if you don't have the HPV DNA, then there is another method that you'll be going there after every 3 years. Though in our guidelines, we will say that you need to go if you have 25 years and above. But what we have seen right now is, anyone, if you have started having sex, if you have your daughter or yourself, you have to go to the hospital to get checked. It takes only within 15 minutes you are done, and it does not hurt. It's not painful. You just go checked, and then you'll go back again after 5 years. In case they find that you have the HPV virus, then we are able to kill it medically. We will kill it on the spot, and then we will prevent it to cause the cancer. Because once it causes the cancer, it's very hard to manage. But once it is the virus, then we will kill. I've spoke so much about the HPV because it is killing so many women. In Tanzania alone, it is killing up to 6,500 women every year. And those are the women that they come to the hospital. We don't know about others who didn't come to the hospital. So approximately about 10,000 women, they will die because of this cancer if it is not treated. That's why I've spoke so much about this HPV here, because it kills a lot of our beloved women. And it does not matter. I have seen patients who are 23 years old, 24 years old, and they have already changed because they have started having sex maybe at 12 years or when they were 15. That's why I spoke a lot about this one here. So another factor now, after speaking about the HPV, we have the virus like the hepatitis virus, the B and C, and we also have the H. pylori, which is causing the gastric ulcers. Okay, so the gastric ulcer causing bacteria, if it is not treated, it can also cause cancer, the stomach cancer later. And finally, at the end, I'll speak about just 10%. That one person who will have cancer because in the family they have history. Okay, so if you are born, for example, your mother had a breast cancer, that means something might be a problem in your body, might have a challenge in your body, and then that thing can also, if it happened to your mother, it can also happen to you. So that way you will see that you have inherited, because your family has a history of getting those cancer, then you might also get cancer because your body has something that it is not at how it's supposed to be. So I'll just summarize here. We have chemicals, like the chemical in the environment that can cause cancer, and then we have the radiation, for example, the sun, the X-ray, and we also have the biological causes. For example, the virus that I've just explained, the HPV, etc. Or you can also inherit it. I think I'll have to pause here for questions.
All right, thank you so much. Mwina mongo fulumira ndiyankhuleko ntichewa makozes amene ayankhula a cancer mazinazo zindivuta kuzika ntichewa komabe momwemo kozi yoyamba ndi chemicals apa ndibwerezapo kawiri katatu choyamba atchulako za fodya kandi fodya wakulu.
Sorry.
Yes.
First of all, I think we have to know if pali munthu amene sakumva chizungucho, because we end up translating.
Okay. All right. If that's the case, I don't know. Ngati simukumva, you can just write it in the comment section, cause yeah. Ngati simunamvesese, just write it in the comment section. I think for now, Ndewuri, I can, while you write in the comment section, I can be taking the questions. I don't know if you guys have questions regarding to the causes of cancer. Write it also in the comment section so that I know, or we should go on, because the last time, right, just everybody that's on the box, just write it in the comment section if you have a question so that I know. Okay, let's start with Edna.
Hi, I wanted to ask about bone cancer. What are the causes of that one? That's the one I'm interested in. Thank you so much.
The bone cancer. Okay. Did you mean the bone cancer?
Yes, BONE, bone, yeah, bone cancer.
Oh yeah, oh yeah.
Thank you so much. Thank you.
Okay, yeah, you're welcome. So, as I explained, the bone, what can cause a cancer of a bone is the same as what can cause a cancer anywhere. So, it can be because something got into the bone, then the bone is not growing well. For example, let's say you were treated with radiation. Let's say you broke your leg, okay? And then when you come to the hospital, then we'll take x-rays and CT scans and everything. If we overdo it, we can cause cancer. That is very from simple speaking, but also you can have some genetic conditions. So there are some diseases that you can have, and then these diseases, they will make you inherit something from your parents, okay? You inherit the mutation, the genetic mutation from your parents. And then when you get this mutation, that means you can you have a chance of increasing of you getting the bone cancer, okay? So for example, we have those terms, I'm not going to say them, but just an example, we have retinoblastomas, which they are caused that way by these diseases. And okay, if you have also another disease that can affect the bone, then you can also get cancer. And finally, I'll just put it in a simple way. Let's say you had an abscess. Let's say this is your hand, and then you had an abscess, a simple abscess. See that abscess, when it is opened, maybe it is opened not at the hospital, okay, and then they just drain it, and then you didn't have any antibiotic, and at that time your immunity is not very good. Then the bacteria will enter at the where you have removed the problem, where you have removed the problem, where you have removed the abscess, okay? And then those bacteria, when they enter, if they are not treated, they can also go up to the bone. When they go to the bone, they can cause bone infection. If you don't clear the infection, that means you don't get proper treatment, then that place can also change into cancer later. So there are several things as I explained. I hope I have answered your question.
Edna, I hope your question has been answered.
Yeah, thank you so much. Yeah, thank you.
All right. Now I just wanted us to go back to the cervical cancer. I think you said something about Tanzania having over 6,000 women. I think
500.
dying. Yeah, a year. I think last year here in Malawi, we were number one of the whole world with loss of death. But this year, I think we've gone down a bit because we are on number 3. Now, you've talked about HPV, but I've also heard it's also about cleanliness on the side of women. Okay, now I just also wanted us to talk about it more broadly because I think,
Yes.
I think it's not really, like you said, your country is becoming kind of advanced. Malawi is a country where it's not easy, for people, especially in the rural areas, to go to get a screening for, cervical cancer, unless maybe some organizations have come in and then they go in the villages and then they do the free screening. But it's not really easy for a person to get screening. Now, as a person, personally, how best can you handle yourself to prevent the cervical cancer itself? Are there ways whereby you can prevent it regarding a person who cannot get the access to screening? How best can you as a person handle yourself to prevent it maybe?
Okay, that is a very, very, very good question. Yes. So to put it into perspective, the HPV is a virus. Okay, there are so many HPV viruses, over 100, but we have like 4 which are problematic. Okay, so these viruses, they stay. Mostly they are found they are transmitted mostly sexually. Okay, so someone has to have sex with someone with HPV virus. So if at first, if it is your partner, if it is your husband, for example, then you will encourage your husband not to have multiple sexual partners. That is the first way to prevent yourself from HPV. But we are all adults here, and we have to speak the truth that to have men maybe who are faithful or women who are faithful that much, now that depends on how they fear, on what they believe, how they fear their God, etc. So in case your husband travels or your wife travels after some time, when they come back, you might want to use condoms. If you use condom, then you can prevent unwanted HPV infection. So you won't get the virus if you use condom. But then I'll also go forward and speak about the elephant in the room. Nowadays we have oral sex. It is very common, even in Tanzania, I believe even in Malawi as well, oral sex. Okay, so that way, if you have sex with someone who has HPV and they are carrying the HPV virus, that means you can get the throat cancer later if not treated. A man can also get the HPV if it's not treated after some time. Though it is very rare, it can also cause the cancer of the penis. Okay, so generally speaking, what you need to do is to get screening. That's why I have spoke about this, because we are human beings, we interact, we are sexual beings, we have sex. So you just need to get screening, and the screening is not that hard if people understand, because you get screened once, even in Tanzania with the new technology, once in 5 years. But if you with the old technology, you'll get screened once in 3 years. So if we have women all over Malawi, understand that because we cannot avoid sexual sex, and we can't see, you can see that your husband has HPV or your wife has HPV, you cannot see. We'll just need to go to the hospital once in 3 years. So even if I'm at the village, very narrow in the village, and then you go, you give them information, and if they understand, they'll get screened once in 3 years or once in 5 years. So the best thing is to do screening, and it has nothing to do with the hygiene, as you have spoken. Thank you.
Thank you so much. There was also a question that somebody wrote in the comment section. I think we are in a world whereby everybody look at themselves and they say, I need to do more. They look at their faces, they say, okay, I need to look more beautiful. You know, I need to, my stomach is big, I need to reduce it, I need to do BBL, all those things are cosmetic procedures. So someone was asking that, is it true that all those cosmetic procedures, especially BBL, also causes cancer?
Okay. So when talking about the cosmetic surgery, you have to understand that, for example, normally your body, if you eat, it will grow bigger. Okay, that means it will save the starch, and then it can make your body to increase in size, produce more fat. You see, and then you will get more bigger. That is the normal way the body will do. But then it stores the fat at first it stores the fat in the buttocks for women, and then it will go to the abdomen, okay, to women, and then to your thighs, and then maybe to your hands and in the breast area. That is the normal way. I'm speaking this so that we understand. So, but when you say I'm going for surgery, I'm going to remove extra fat, I'm going to reduce the size, what you do is you are going to cut the portion of the liver, or to reduce the space where it was supposed to grow, to increase in size. When it is done very well, and trained doctors who understand what they are doing, it is not very risky and you won't get cancer. But because it is very expensive, very, very expensive, people now will start to go to other doctors who are not sometimes very well trained, or because it's cheap, you go there. So now the complications of the surgery can proceed and cause cancer because of the chemicals, because of the procedure itself, etc. So to answer your question now in a summary, it is not that the surgeries, they cause cancer, but if they are done in a way that is not very technical, then the wound can later turn into cancer.
Right. Thank you so much. There was also another question in the comment section as well. Somebody asked, is it true that cancer affects 90% of people who are HIV positive?
Okay. Thank you for that question. I also work in the field of HIV, and we are saying when you have HIV and you don't take your ARTs, you don't take your medicine well, your immunity will go down. When your immunity goes down, then these other things like virus and etc., they can harm your body faster than someone who does not have HIV. So if you have HIV and you don't take your medications well, then you are easily to get cancer 90 times more than someone who does not have HIV. And so it is true if you don't get medication. But if you have HIV and you are taking your medications very well, then you have enough cells, immunity. You have enough cells that can protect you. You have your immunity even higher than someone who is not also using ARTs, who is not using medication. So it depends. If you, to summarize, if you have HIV and you don't take your medications well, then you are most likely to get cancer more than someone who does not have HIV. But if you have HIV and you take your medications very well, then you are not likely to get cancer. You're just like anyone else.
Thank you so much. Another question as well. Okay, so this person was connecting cancer with diabetes. Was asking that. Okay, let me read it. How connected is diabetes and cancer. We have seen most people who have diabetes, and maybe at a point they have wounds that doesn't really heal. In the end, it develops to cancer. So how related are the two?
Okay, thank you very much. That is also a very good question. So I will just explain a little bit about diabetes. So when you have diabetes, it means your body has too much sugar, okay? And then this too much sugar, what it does, it will go and it will stick itself in your blood vessels, okay? Assume that you have that tape that you use to spray your flowers or something. Then that pipe, because let's call that pipe your blood vessel, okay? And then if you have diabetes, then this excess sugar will go and stick inside, okay, this blood vessel. And then that means the size of this blood vessel will decrease. When the size decreases, it means the blood which will be supposed to be to pass, it will be reduced, okay? So when you have the diabetes, it means your blood vessels will not be taking enough blood everywhere. Now what blood does is it helps your body to pass red blood cells, which they help you to heal and pass and also kill diseases with white cells. So I just wanted for us to understand that first. So when that happens, when you have diabetes, that means even if you have a wound somewhere, you might cut yourself here. But then blood which is supposed to come from everywhere in the body and to this wound, it will bring the soldiers, the white blood cells, who will kill the diseases and also help this wound to heal. It won't heal, okay? It will be delayed. It won't heal on time. So when this wound does not heal on time, later it might like any other thing. If you have a tomato that you have not kept it in the fridge, it will rot, okay? So what happens here, if the wound won't heal, it will rot, or if it will delay to heal. So people confuse the wounds, the diabetic wound. They say it is cancer, but sometimes it's not cancer. It's just the wound that they cannot heal over time because of that excess sugar that has deposited in the blood walls. Therefore, they reduce the blood walls. And also, remember, you also have your nerves, okay? The nerves that they take sensation and everything. Those nerves, they also need blood to function, okay? So if the blood does not go to those nerves will also die, so that you will not feel anything here. So you'll have a wound, but because you have diabetes, then this wound won't heal, and bad enough, the cells that they're supposed to take the information that you have a wound, it is painful, they are not there, okay? So you won't feel that you have a wound because you don't feel pain, and that wound will keep on growing, and then maybe someone who is helping you, maybe maybe it is your mother, then if you want to help her, you will see that, you have a wound here. Then they'll say, I have a wound, I don't know, because you don't feel pain. So that is the problem. So that wound won't heal, and sometimes it's confused that it will be cancer. But that wound can also turn to cancer if it is left there for a long time without getting treated, and something else happens, and then later it might turn to cancer. But usually they're just wound. I hope I have answered your question.
Yeah, you have. Thank you so much. Sherry, you said you have a question. I give you the floor so that you ask your question.
Okay, thank you so much. I think nitakuuliza kwa Kiswahili kwa ajili ya mambo ya Kiingereza. Sometimes watu wataanza kunicheka hapa, Kiingereza sio vizuri. Nataka nijue daktari, kutokea kwa mtu amezaliwa na albinism, nimesikia ni common kwa wale watu kuuma skin cancer. Tena nimesikia kwa watu wengi kafariki kwa ajili ya skin cancer, watu wanapozaliwa na albinism. Kwa hiyo kuna njia tutafanya kama I prevent your skin cancer, hata kama unatumia kila kokoto utachotumia kama vile expensive lotion zao, mawani hao anavaa, hata kama vile vikofia anavaa, anajiprotect pa chochote. Hata kama kwa hiyo kuumwa skin cancer ni lazima basi hata ufanye kitu chochote pa moyo wao.
Okay. Sawa, swali zuri. So nijibu kwa Kiswahili au I answer it in English?
No, please,
I think you can answer in English. It will be much better for everyone can learn.
Okay.
Yeah.
Okay. Sure, thank you. Yeah, so your question is about albinism, relationship with albinism and skin cancer. So when you have an albinism, that means you don't have the black pigment, the pigment that help your skin to become dark, like mine, or even if you're a white person, you also have the pigment that helps you to filter the ultraviolet light. So at first, when I was discussing about cancer, I said some of the cancers are caused by too much sunshine. Okay, so that sunshine that we usually get, it is filtered. Okay, so you just literally think that you have a filter. Okay, the filter that filters the lights that comes to your body, and so that only the accessible or needed amount is allowed to enter. But when you have albinism, then you don't have that black pigment. This pigment, that means no, these lights, the ultraviolet light or the sunlight that comes to your body, it goes directly to your cells. So that way it is able to destroy the cells and cause the skin cancer. And you have said it very well that you can prevent by wearing shades, wearing glasses, or to make sure that you have the lotions. So the lotions act as the buffer, act as that green, that filter, act as the filter. Yeah, and not all albinism will get skin cancer. Depends on how much they are exposed. So if they are staying indoors or if they are outside, they are wearing the hats, they protect themselves from the sunlight too much, then they won't get cancer, or if they are applying the lotion. But if they don't apply the lotions, or if they are, I don't know, maybe they are too poor to buy it, and then if they get that light too much and their body cannot fight it, then they are most likely to get the skin cancer.
Sherry, I hope your question has been answered, and I hope you understand.
Yeah, asante sana daktari, hapo nimekuelewa vizuri. Ziko mkoa mbili la tukosi.
All right. I think on the same, maybe kind of related. I'll also go to, we're in a world whereby, like I said the other time, that sometimes people don't really like the way they look. So they tend to, they tend to go and say, okay, I want to enlighten my skin. I want to brighten my skin. And mostly in those brightening creams, there is the chemical that is called hydroquinone. And basically, what they tell them when they is that when they're putting on the lotion, they shouldn't go on the sun when they have just applied their lotion, meaning that hydroquinone and the sun doesn't really work together. I just wanted to know also that are those people who bleach at a risk of getting cancer, especially skin cancer, or it's normal to bleach the skin?
Okay. Yes. So simply answering is, if you use the brightening skin, you affect how your body is working into making the black pigment the filter that I explained. Okay, it affects that. Okay, so it affects the shield, it affects the melanin. So that filter is destroyed. That way, it does not make, as I said, about 30,000 cells they die in a nucta. How do we call this in a simple way? Yeah. So if you put your pen and put a dot, a pen tip, okay, in that area, that small area, over 30,000 cells they die every minute. So what your body does every minute, now it is giving you new cells, giving you new cells, new cells, new cells. But when you have this, use this brightening skin, or this brightening lotion, what they do is then they will kill your body ability to produce the shield that helps these cells to filter the ultraviolet, to filter the sunlight. And then later on, you are putting yourself in a very high risk of getting skin cancer. So you have to be very careful. And the toxic ingredient which you have spoke, the hydroquinone, is the culprit, is the biggest cause, because this is a bleaching agent. Okay, what it does, it is directly causing cancer. It's not itself direct causing cancer, but it reduces your ability, the ability of your body to create the melanin, and then later on, the skin will be, if you get hurt yourself, the skin will be very hard for it to heal, and etc. And later on, you can get cancer.
All right, thank you so much for that answer. To all those that are just joining us, we are here on TD Bar, a place where we pour ideas, not alcohol. We are here with Daktari here with Daktari Kiganjani, where he's a doctor all the way from Tanzania. We are talking about cancer, what it is, how it affects us, and what every one of us should know. So it's a very important conversation. If you're just coming, if you have any questions regarding cancer, if you ever wanted to ask questions but you didn't know who to ask, this is the right platform. We decided we need to be having these conversations because sometimes, especially here in Malawi, we are at a place whereby most of us can't afford to go at the hospital for consultation, but we're here right now having this discussion to make it easy for everybody to listen, ask questions, so that after this conversation, you can now make decisions, you can be well informed, and also take care of your bodies very well, prevent the things that you need to prevent, so that maybe the problem of cancer doesn't come to you. You can tell a friend also the information that you've gotten here. You can go tell your relatives. Maybe you will save a soul. They say health is wealth, so it's also very important to take good care of your health. So, doctor, we've talked about cervical cancer. I've forgotten the cancer that affects mainly men. I think you tell me about that. Okay, what do you call the cancer that affects mostly men down here? Does it really have men, and what are the causes? Yeah.
Okay, yeah, so to us men, we are affected most of the time by the prostate cancer, which is the cancer of our special organ that makes the food for our seeds, our sperms. So our sperms, they get food from food, and also the lubrication by being produced by this organ called the prostate. Okay, so when we are young, we are born with a prostate, and the good thing about prostate is it grows, it keeps on growing and growing and growing all over. That's why when you are 45, a man who is 45 and above, you can start seeing the challenges that prostate it has grown by blocking either the urine or making the urine, making it is funny to urinate. Maybe the urine won't go as far as you want it to go, and sometimes you can feel that you want to go to the toilet every time, etc. But later, if it blocks completely, you cannot get the urine completely. Now that gland, which makes the food for sperms, it is when it is growing after some time, and you have been living sometimes unhealthy life, which we will discuss later how to prevent this cancer. We'll talk in detail how to prevent these cancers in a very simple way. And then you have that prostate. If it gets the point that you are supposed to treat it and then you don't treat it well, or you treat it and then that surgery injures the cells around it, it can turn into cancer. But also, if you have been living in an environment where you have these industries, there are chemicals all over, then those chemicals can cause, once you drink them or anything, they will get to pass down through the to get taken out by urine, and in that way they will enter, and then they can cause later on cancer of your prostate. And then once you get it, it usually, because it's very small, it's usually very easy for it to jump to next organ, so it spreads very fast, and that's why our fellow men, they will also die out of that. So it depends on where you get treated and when you get treated and the environment around you. And finally, if you have had schistosomiasis, if when you were young, when you went to pee, you were peeing blood because of that infestation, and that in time, if it's not treated very well, can also cause cancer. So it's a very common cancer in men. But when we talked about HPV, I said that men can also get the cancer of the penis. Okay, I think we can just address it as it is here, because maybe we're all adults, and they can get the cancer of the penis. But it is not because of the HPV, because it's not mostly because of the HPV, because HPV can wear off. But if you have had other infections and then you have had HPV, then that HPV is not cleared, then maybe you can get the cancer, but it's not commonly related most of the time to the HPV. Thank you.
All right, thank you so much. That is also well understood. Before we go into the next phase, which is prevention, I think Sherry had a question as well. So Sherry, I give you the floor to ask your question.
Thank you so much. Maybe I'll have 2 questions right now. The first one I can ask in English, but the second one, I'm not sure if it will be comfortable with English. So, nitaongea kwa Kiswahili, utaniambia kama ni fresh, kawaida, hata hapana.
So.
Yeah. First one is that somebody can have cancer, and maybe they find it on the first stage of cancer, he got treated, everything, and then we hear that he's cancer-free or he's cancer-free. Then we have to hear that after some time, the cancer is back. I would just want to know, like, what causes those kind of things for cancer to be back? Is it like normal because it was there before? It wasn't treated well. It did, maybe all cells wasn't killed, or what happens? And second question is, nimekuwa nafanya kazi kwenye hospice. Unajua hospice ni kule kwa watu kama akashauma sana, tena anakaa basi anasubira siku lao la kifo. Pale wale watu tunawapaga vile dawa zinaitwa morphine. Nataka nijue nilikuwa nataka nijue kama ile dawa kabisa kazi yake ni kazi gani, kumaliza ule mtu afe, hata kama kazi yake ni kazi gani jamani.
Okay. So,
asante.
Thank you very much for your question. So you have asked that you will see that some people, they get cancer and then they get treated, and then maybe it was in the first stage, and then they after some time you say that they are cancer free or something. So I'll just explain it in by providing 3 causes of that. So when you have cancer at first, what we will do right now is, if it is at the very first stage, for example, we are seeing the cancer here, it's just a swelling, it's easy to cut that swelling, to remove it. You cut this swelling and remove it, and then later treat with medications. okay, to this person, treat the medication so that if there are any other cancers around it, they get killed. Simply put that way. And then if it goes beyond, then that is swelling, maybe it is also into other things, okay, we'll say maybe it is in the next stage, stage 2, then we'll also need to kill it with the radiation, okay, the rays, okay, we need to kill it with the rays, the radiation. And then maybe we are successful, we kill it, and then you are fine. But then what happens for it to return, it depends on 3 things. First, maybe because the cancer, the biggest fear with cancer is we call it metastasis. That means the cancer cells, they will move from where they were, then they'll go to the next organ, or they'll go to other places. For example, they'll go in the bloodstream and then they'll get transported. So they'll go to the heart, to the lung, to the brain, whatever. So if we were able to fight that cancer before very well, and it didn't have, and we didn't know that maybe it had metastasis, these cells which they move, it didn't have the cells which they move, then we will miss. We'll miss, and then these cells which they have moved, they'll go and sit somewhere else, and where they go and sit, they will cause another cancer, or they'll go back again to the same place that we destroyed before and cause another cancer. And this time it will grow even higher and faster than the previous, because we cannot see these cells. Even as doctors, sometimes we cannot miss, and we don't scan the whole body to understand maybe if you have metastasis or somewhere. Okay, sometimes also we can have what we call sleeping cells. The sleeping cells are your cells. We see that it's just a tumor. Sometimes you have a swelling. For example, if I'm sure all of us know a mole, okay? That mole that you see in someone's skin, that is a tumor, okay? It might be the same tumor as that of cancer, but this tumor here, it just has cells, but they don't move, they don't grow, they're in a controlled space, they don't cause any problem. So that is a tumor that is just sleeping. So, but when you have the cells like that, when sometimes they change, they might cause a cancer, and in that way they will multiply faster, and then they will cause the remission of the cancer again. So when you have the dormant cells or the sleeping cells from that cancer, you have the cells from that cancer, they go somewhere, they become sleeping cells, and then later they are reactivated. They will just cause cancer later. Okay, and we have to understand that most of the patients who have had cancer, they had a very weak immunity. Okay, so even if these cells they go there, they are not easily killed because your immunity is down, because you were fighting with cancer. And sometimes the cells are just very tough. The cancer cells, you kill it, you do your best, but sometimes they in the mixture, they just escape your medication, they escape your radiation, and then later they will just come as mutations and cause cancer again. So that's what happens to your first question. It's either the cells are very hard to kill, or they were sleeping, or they have moved from places and caused the cancer at that place or other place. And on your second question, with the drug that is called morphine. So simply put, morphine is the very strong medication that help. It's an anti-pain. Okay, it helps someone who is, for example, if you have cancer. Okay, you have cancer and you're in the 4th stage, the last stage. Okay, in that way we are not able to help you anymore, because the cancer now has metastasized, has gone to almost everywhere in your body. So it is everywhere in your body, and that way we are not able to kill the cells, because if we want to kill, then the cancer cells are in your heart, they're in your brain, they're in your abdomen. So if we want to kill, we'll also kill that other cells, the heart cells or anything. So we'll leave you to do your goodbyes and stay with relatives until death comes. So, but because, as I've said, cancer causes masses, okay? It produces masses, and these masses are very big, okay? And because they are huge, they usually compress other structures. So if you have a cancer in the example of the finger, then that cancer will compress the bone, will compress the blood vessel. This place won't be moving well like that. And that way, that finger won't be working well, and you'll feel a lot of pain. So in order for us to help you, we'll give you that morphine. The morphine will be the drug that will help you to reduce the pain, but it does not kill the patient. It is there to help the patient, these patients who are terminally ill, to have their pain reduced.
Sherry, has your questions been answered?
Yeah, it's very clear. Thank you so much. Thank you.
All right. All right. I think there is one more question before we move to the third phase. The question is, what is the hardest cancer to detect?
Okay, that is probably a very good question. The most hardest cancer to detect depends with the age. I'll just put it this way: the cancers that develop very slow, that means they grow very slow, 20 years, 30 years, they can be very hard to detect, because you need to have symptoms, okay? And then people won't come because they don't have symptoms. And because of that, they will come late, and the cancer itself comes late. It grows very, very, very slowly. By the time you identify it, it has already grown, and it is very big to understand. So it depends. It can just be the cervical cancer, but it depends on the location where that cancer is. I'm just giving an example. So the location matters a lot. So if it is in a very hard place to see, maybe it is in the blood vessel, then that will be very hard cancer to understand and to detect. So in that manner, because of the location, I'll talk about the pancreas. I don't know, in Swahili you call it bandama, but the pancreas, the organ that makes the insulin, that regulates your blood, okay? That gland, it's also, the cancer can attack it, and it can grow very slowly. So it's very hard to diagnose it very early, the pancreatic cancer. That's why when you get pancreatic cancer, most people, they will die earlier. They will die. Most people will die because it is very hard to understand it, because it's very hidden. And also for women, we have the ovaries, okay? The ovaries are also very well hidden, okay? Location, they're also very well hidden. The ovaries, because they are very well hidden. Now, if they get the cancer, now it's also very hard to identify. And also, I'll just give two more. We all know the liver, okay? The liver also, though it is somehow behind your rib cage, in the front of rib cage, but it's also very protected. It's protected by your ribs, okay, and the other structures like your gut, okay. It is protecting it. So because it is inside, it's also very hard to see. The liver has to be protected because it's very important. And also your lungs. Yes, your lungs are, you see, they're here, but they're also protected by your rib cage. And the lungs, they're taking air. They have a lot of cells, the immunity cells that are fighting the disease, and etc. And so for it to detect to detect early, it's very hard because that the lungs, they are doing very well and they have those small cells that are working, they're working simply. And we know that we take chest x-ray, right? They will do chest x-ray. You know, the chest x-ray can also cause that thing. And the lungs itself, they're not very well seen in the chest x-ray. Yes.
All right. Thank you so much. Bondela, I didn't see your comment, so yeah, I think you can ask the question.
Well, thanks very much for having me. Thanks very much for having me. Trust me, I'm at a barber shop here. I was about to go out, put myself a chef, but I've been here. I haven't even taken off the belt. Oh, let me even open the cam. Because of the good explanation, I've been blessed. Trust me, I've been blessed. I've learned one or two with the way you were putting it out. I don't think there's any much questions. But one thing I just wanted to know is cancer genetic, right? And yeah, and what else? Symptoms of maybe the lung cancer. What are the few early symptoms of lung cancer? Because you know, I realized it when I went to South Africa. That's when I realized that white people, they get checked up before they get sick. Because my first job, they were like, you know what, tomorrow all the new employees, you are going for checkup. And I was like, but I'm okay, I'm all right. And they're like, no, we do it. So that's when I realized to say, oh, that's why black people, poor people, let me say, we get hit a lot, because we realized already when the disease has penetrated and you cannot treat it anymore, you know. So yeah, the symptoms of early symptoms of lung cancer, and is cancer genetic. That would be amazing. Otherwise, I was taking down the notes, and trust me, after this live, I'll open an online therapist. I'll be a therapist. Trust me, because I've been. Thanks very much.
I'm delighted. Yeah, I'm really delighted to see that you understand. Actually, that is my mission. Even my name is Daktari Kiganjani. Kiganja is your palm. So your palm is very close to you. That's why I named my channel Daktari Kiganjani. It is also in this TikTok where our followers can also follow me. It's also in Instagram, whatever. So I usually like to explain it in a very simple way that we can all understand and teach ourselves, okay, and prevent these things from happening. So to answer your question is, cancers are not genetical. Yes, cancers are not genetical. I've explained before that some people can get cancer because their sibling had cancer, okay? But maybe you are the mother or the father had cancer. But that explains that in your father or your mother, they were something that maybe she could not control, and because maybe the certain body part is weak, then she got cancer. That means if you are not also careful, you can get cancer. But cancers are not contagious. You cannot transmit cancer from one person to another. So that means a mother cannot pass down cancer from her womb to her baby. That is simply asking like that. And I like the way you have put that our fellow white people, they will, okay, calling them white people is also not good as calling black people. Okay, our fellow Europeans or from other nations, they have a tendency of getting screening. Yes, we'll need to screen for everything, because you cannot know if you have something that is silently sitting with you, and maybe because we'll talk about prevention later, and you have not been doing those things to prevent you, then you get employed, and later they find that you have cancer. And to your question on lung cancer, so as I said, lung cancer is very hard to detect, the same as pancreas, the same as the liver cancer, the kidney cancer, etc., and the pancreatic cancer. They're very hard to detect. So for lung cancer, the symptoms, and here you need to be very careful, because these symptoms, they look the same as if someone has respiratory tract infection. So you'll have a persistent cough. Someone will be coughing and coughing and coughing. The cough does not go away. It is chronic and it's getting worse over time. However, you need to be careful because even TB present that way. That's why I said you need to be very careful. Don't stress yourself. Because we are here speaking openly, someone may say, hey, I'm coughing. It has been a month. I'm coughing. Maybe I have lung cancer. No, don't stress yourself. The symptoms or the disease that they don't read the books. That's why as doctors, we're here to help and put this into understanding. We go to school, some of us for more than 25 years, we go to school so that we are able to understand and put this in a very easy for you to understand. Another symptom is the chest pain. Chest pain with the discomfort, that also worsens over time. So you have a chest pain that is paining. When you breathe deeply, it is so painful. And over time, it keeps on increasing. Even if when you try to laugh, sometimes the pain gets really, really intense. That is another symptom. And also because your lungs, they don't have enough air, they don't carry enough air, so you'll feel shortness of breath. You'll feel like you can't breathe, okay? But then again, these symptoms, they do go with so many diseases, so you need to be careful. Please do not stress yourself. Start saying that I don't believe I have a lung cancer. And also, so these symptoms will be accompanied by coughing blood. You can cough blood because your cells are dying and they have blood. So they cough. When you cough, the blood will be coming out. But it can also just be TB. So you also need to be very careful. Your voice will get hoarse because there will be changes in your voice because the windpipe, which is producing air, does not get enough air. The air does not circulate very well. Your lungs they have either collapsed or they've reduced in size, etc. So your voice does not get very well, and it sometimes becomes itchy. So it is hoarse, and also you can start feeling wheezy because maybe the windpipe is blocked. See, the wind, which gets you air, is blocked somewhere. So you can start getting that wheezy because there is a narrow space. Now the air cannot pass from your lungs and coming out to produce sound. And also you can also get frequent lung infection. They will tell you have pneumonia, you have bronchitis, and etc. So very many infections. So I want just for my friend from South Africa just to understand that these symptoms, they can be from several diseases and they need to be there for a long time, and they will be accompanied by tests. So the tests will tell us that you have really lung cancer, and not, if you have these symptoms, don't complicate yourself and start thinking that maybe I have lung cancer, because if you stress yourself, you can also get disease. We'll talk later about how to prevent this cancer. Thank you.
All right, thank you so much. And Nthanzi, you can ask your question.
Oh, I don't know if you guys have already talked about it. Have you talked about the preventable cancers already?
That's the next step we are going into. All right. I think now we can go into the first of all is cancer preventable. What are the preventable cancers, and also we can go into that phase now.
Okay, thank you very much. Now because we have talked a lot, we will go straight to the prevention. And to answer your first question, is cancer is preventable?
I'm sorry to cut you short.
Yes.
Mr. Malawi, the bulldozer, says he has a question, so let me just give him a yeah.
Sorry, I'll ask the question in Swahili because of some privacy, but the answer will be in English, so it will still make sense. Mheshimiwa, watu wengi walikuwa wanauliza hili swali, lakini wanaulizia kwa mbali kwa sababu hiyo kitu ilitokea huko Malawi. Shida, kulikuwa na jamaa ambayo amefariki kwa sababu alikuwa na shida ya hii kansa ambayo kwa huku meno huku alikuwa ule mfupa ulikuwa unajaa. Ndio maana yake walikuwa wanauliza hiyo jaa kwa sababu nimetoa jino sijui nini, walikuwa hawataki kuongea straight kwa sababu kimetokea. Sasa kwa sababu hiyo ilikaa muda mrefu na alikuwa kichwa kinakuwa, akienda hospitali wakimfanyia matibabu na unakuta wanasema tuwezi kufanya hiyo kwa sababu kichwa kinakuwa imekula brain yote. Hapo unakuta huu mdomo unafunga kwa sababu ule mfupa unakuwa sana. Sasa wanaenda mbali kwa kuuliza kwa sababu hawezi kwamba waonekane kwamba wanamtaja yule mtu. Asante kwa hilo. Kama unaweza kuliongea kidogo itakuwa poa.
Okay.
Thanks a lot, guys.
So thank you very much. Yes, thank you very much, Wellington, the bulldozer. So he's my friend who also connected me to this wonderful session. I have worked with him. He has trained me before when he was in Tanzania. So thank you very, very much, Wellington. So on your question, yes, so cancer are different and everyone is different. We'll see here when we talk about prevention. So just because someone has had a cancer or irregular growth, the bone growth or the jaw growth, and that made the tooth go out and everything, that means that person had something among the things that we talked. Maybe he was exposed to chemicals. Maybe he was exposed to radiation. Maybe his diet was not very good, where we are going to talk here. Maybe he was not exercising or whatever. And then over time, that trigger caused the development, and when it went on growing and growing, then it became a problem to the point that when he went to the hospital, it was too late. We could not, the healthcare worker there could not support this person. So we will need to understand one thing, that everyone is different and everyone is built differently. And it sometimes can just be an isolated case of just a single person having that challenge. And because it was just maybe one person, then it is not a community challenge, but it can happen to anybody. That's why, maybe because it is caring as African, as my friend from South Africa has just explained, because you're just scared, okay? And then you just create a hype, and then people just thinking, oh, this is cancer, maybe it is transmittable, maybe it is causing this and this, but the actual sense it doesn't. And it could just be, from the way you just explained, it could be a cancer of a bone, and the bone will increase because, as I already said, if it is cancer, it is causing a mass. That mass will be getting bigger and bigger and bigger. So because it's getting bigger and bigger, that mass is sitting in a bone, so the bone will be seeing as if it is growing. Okay, that's how people see, oh, it is growing, but it is because that cancer in the bone, it is increasing in size, and then it is pushing the bone outside. That's why you see it is growing. So it was the case, and from the way you have explained, that means this person was late. They went to the hospital maybe late. That's why we will talk about prevention in the upcoming session. Thank you. I hope I have answered your question.
Mr. Malawi, has your question been answered?
Yes, please.
All right, now we dive into the prevention part, so you can go on.
Okay, so when I want to talk about prevention, I don't want us to complicate things. We usually say, doctors, they say, do not do this, do not do that, do not do that. But I'm not those type of doctors, and sometimes the doctors are different. There are doctors who will just tell you something so that they want to sell you medications. Very few doctors, though many doctors will go out there and we take an oath to support you, not to get a challenge. But because we are living in life, and these things, as I've explained, 90% of the causes of cancer are the things that we we have in our environment are the things that are happening to us every day. So we will have to see to put a balance in it. Just as a disclaimer. So the first thing is, I'm not saying if you can, but I will strongly advise you to avoid tobacco completely, because in my years of study, from the first degrees that I did, like 6 years, and then other two bachelors that I did, like 6 years, another, putting into so much research and being involved in this. And I've worked with several doctors from different countries, from Tanzania, US, UK, etc. I have never seen even a single advantage of tobacco. Okay, so people will just tell you what they want to tell you, but I am advising you, as my friend, avoid tobacco at all times, because it causes more than 40 disease in your body. Like if I put in percentage, big diseases, if I put that in percentage, 60%, 60% of all diseases are being caused by tobacco, not just cancer. So if you are hearing this, please avoid tobacco completely. And if you have been smoking tobacco, we can talk. I have helped so many people to stop smoking. So it causes not just lung cancer, it causes almost everything. So it causes carcinogens. The chemicals that produce cancer, that is the mother. So it produces the cancer, the carcinogens. So just please don't do that. The next thing, it is a struggle. You have to maintain a healthy weight. Now here comes a challenge. I'll just give an example. If you see Mr. Malawi, Wellington, how much do you weigh, for example, right now?
84.
84, okay. And how tall are you?
70.
70, okay. Yes, I'll just take this an example.
For
that to understand. 170, yes, and I understood that. Yeah, so for us to put this into perspective, it is like this. The simple way of understanding how much weight you are supposed to have, if you are not bodybuilder, you're not exercising, and you're not exercising to build your body, is simply like that. Just go to a tailor, or even at home, take a tape measure, put a tape measure, and then read that reading in centimeter. For example, it is 170, 75 as Mr. Malawi has just explained. Then he minus 100. Okay, just minus 100. So the 70, that is the answer that is remaining, is the weight that roughly you're supposed to have, plus 5 minus 5. Okay, so if you are not in a work that is like you're not lifting weight, you're not bodybuilding, okay, you would want to maintain your weight. Okay, when your weight is well, you have a very good chance of fighting all diseases, including cancer. So when you are obese, when you have overweight, your weight is too much, you right there, just alone, you are predisposed. That means you can get up to 13 cancer just by being overweight. There are almost 13 cancer that they are coming to you. Okay, yeah. So because the weight is among your biggest enemy in life. So try your best to exercise, and we will talk. For example, Mr. Malawi has been my trainer, and what I usually teach people is, you don't need to go to the gym for you to be fit or to be well. Right now, what we tell you is like this: please walk at least 1 hour. Okay, you just walk for 1 hour and then come back. If you do that 3 times a week, then your body will thank you, because you'll be well. That only with also taking good diet, which I'm going to talk. I mean, you control the amount of food that you eat, because most of the food that we eat, we don't need it, but we just need to eat it. Okay, so just maintain healthy weight. I had to talk a little bit more there so that you prevent yourself from cancer. And you know what? Because you can be obese today, you can be obese for 20 years, 30 years. You say, it's fine. But later, when you are old, your body is not able to fight for the new infection, is not able to support you. Then there is where you start getting problems, because you have been overweight. Okay, another point is move your body regularly. I spoke this when I was speaking about overweight. So try your best. If you're blessed, like my friend from US, I mean from South Africa, I saw that you're sitting on your car. We are blessed. When you have a car in Africa, it is a blessing, and we thank God for that. That is a very good thing. But if you having that car, it should not make you rest. Please move. When you have that car, you can either go to gym, or when you're parking, you have parked that car, walk with your family at least 3 times a week. Walk at least 1 hour. So just put your watch, then walk 1 hour. Then when you come back, that will be done for a day. And don't listen. I'm not saying run. I'm saying walk. Say at not a very small pace, but at least that pace that is not running, but in the middle. So just walk. Okay. I'll just tell you a secret. Your body knows when you exercise. You just say, I'm a petty trader. I have a job that makes me move a lot, so I'm exercising that way. No, your body knows that we are working, so it will put you more energy to help you finish your job. But when you say that I'm going to exercise, then your body changes. It connects with you, and it turns into a machine that burns fat, burns this extra weight. It removes the extra weight. So just move. Okay, and then do not avoid eating vegetables, okay, and fruits. I'll give you a secret. Sometimes we are in the countries that we cannot have the food that maybe our mothers gave us when we were young, but these food, maybe they are not good. They might cause cancer. But the good thing is, if you eat enough vegetables, if you eat fruits as much as you can afford, and you also get, like, for example, beans, etc. So those fruits which you eat and the greens that most of you maybe would, but most of people wouldn't want to eat. If those greens, they have I would say anti-cancer agent. Okay, so they have something that removes the radiation. So when you have those radiations from this food or anything that we talked from chemicals, that radiations will shoot your cell, and then that cell can change it to cancer. But when you have greens, when you have fruits, these fruits, they will help you. Okay, they will produce something that attacks the radiation and remove the chance of your cells to become carcinogenic. So just putting that in simple terms is just like that. So you just need to eat enough greens, okay? And then I would say eat less, or when you eat, make sure that you accompany with greens. So we usually say eat less red meat, for example, beef, lamb, etc. Eat that less, because I also talk about sausages here, whatever, the hot dogs in countries that is developed, like from, I don't know, maybe for my friend who is in South Africa. These are called processed meat. Okay, that means they are processed meat. Okay, they are the meat that have ingredients that can cause cancer if it's not very well balanced. So if you eat meat, we all love meat, eat meat, but exercise, eat greens, eat the fruits, okay? Make sure that you have that balance, okay? Don't just eat meat. Eat as much as you want to eat meat. eat greens and fruits in the same manner. Okay, I will talk about alcohol. Here it is another thing. They'll say that doctors are the binge drinkers. Doctors, they drink more than anybody. Yes, doctors are other people. I'll just take that from there. They are also facing different challenges in life. We are taught so much into treating diseases, into doing this, into doing this. So, but most of the doctors, they're not very good at socializing or having enough time with other people. So we would say that maybe doctors have maybe higher EQ, IQ, okay? Maybe we understand things, we know them, but then we have very less SQ, the social conscious, the way to interact with people, to talk, to solve problems, like the way people solve. Then sometimes we fail. And then these people, because they don't know how to seek help, maybe they'll go into drinking. That happens not just to doctors, happen to a lot of cadres, some lawyers, some other people. They do drink a lot of alcohol, and they do that to pass time. Okay, so I would argue you to limit alcohol consumption. Please do your best. Do not drink too much alcohol. And it is very easy. We'll say that if you're a man, a day, maybe you should just take a single beer, not wine, and maybe 2 beers of 250 liters. And then if you're a woman, you need to take just one. That is to put into calculation. But we all know that many people who just go to drink, they won't just end there. So it is very hard to limit yourself. So drink less alcohol. Try your best, because the alcohol is your biggest enemy. When it is too much, it produces the chemicals they call acetaldehyde. I don't want to put jargons into your body, but they just produce something that damages your cells. They damage the engine of your cell, the DNA. And that way it causes cancer later. And later, we have talked about our friend with albinism and etc. But even yourself, protect your skin from the sun. If the sun gets too high, get indoors or get in shades. But if you are supposed to work in sunny environment, make sure that you rehydrate yourself. You eat greens, a lot of vegetables and fruits, as well as you take enough water. Okay. Yes. Another thing on how to protect yourself. Here we talked about the HPV vaccination later. HPV virus, which causes cervical cancer for women, which is the leading killer for women. First is cervical cancer, then the breast cancer. And you need to get vaccinated. So if you have a daughter who is 9 years old up to 14 years old, and you know that they have not started having sex, please let them get vaccinated, okay, against HPV. So the vaccine will help their body to kill the virus, the HPV virus, once they get in contact. And even if you see that your daughter has started having sex, you can take them to the hospital. They'll get screened. Once we know that they don't have HPV, we can vaccinate them. That is the biggest help, because we know that people have sex. They will always have sex. So, but if your daughter is vaccinated, that means we are almost guaranteed that they will not get the cervical cancer. They might get other cancer, but not cervical cancer later in life. So you need to support this. And because our African countries, we know we don't have enough. We are a little bit under-resourced. In other countries like US and UK, vaccination is up to women who are 25 years old. But over here, they are just limited to 9 to 14, so that we are able to support this group, the growing group, so that it does not get cancer later. So I think I've talked there. I've talked about exercise. I've talked about eating well. I've talked about stopping smoking completely, reducing alcohol, getting vaccinated. I told you to move, walk, protect yourself from the sun, and overall just take the balanced diet. The balanced diet is not the diet that is prescribed. Anything that is available in your environment can be made as a balanced diet. I think I can pause here.
All right. Thank you so much. That was a very good explanation. I don't know if we still have more questions. If anybody has questions, I'm giving you the floor to ask the questions. We'll be here up until 17:30, so you still have a couple of minutes for you to ask questions. Daj, I think you had a question. I don't know if you still have a question after listening. Okay, I think she doesn't have a question. Those that have just joined today, we were very much privileged to have a doctor all the way from Tanzania. We are here talking about cancer. We've talked about a lot of things. We've talked about the what exactly cancer is. We've talked about the effects. We've talked about black and gold. If you can also ask your question in Tijewa, it can be translated. It's very much okay. So we've talked about a lot of things, the causes and also the prevention. So it's been a lot. It has been a very wonderful conversation. Maybe before we go to the end of closing our conversation today, which I also believe that this is not the first. I mean, this is not the last time for you to be here. We will have this conversation and we have a long way to go, but maybe for today, looking at the generation of today, looking at us, the youth of today, we are the people that most of the times you get to have a headache and then you just feel, let me just take some paracetamol. You are having a stomach ache and then you just, okay, let me take some buffen. We're a generation that's very afraid to go to the hospital. We just tell ourselves that we're going to be okay. With that, a lot of things are happening in the body. When you realize that it was something big and it's always too late, what can you advise our generation? Especially, I
Especially in Africa. In Africa, there are very few healthcare workers, and there are very few, maybe hospitals ratio to doctors patient ratio is very high. For example, in the UK, I'll just give you an example. One doctor get to treat only 200 people per year. But I can tell you, even in Tanzania, sometimes when the clinics are too heavy, sometimes I have to see, I remember the highest number of people that I saw a day was 160. Yes, that day I was alone. I saw 160 people. So it reached a point that I could not even support them. I just had to support. If you have pain, I'll just give you the antibiotics. Anti-pain, so that you come back tomorrow for proper research. So because of that shortage, people do not want to go to the hospitals because they are very long queue. They are, you'll have to waste the whole day. That's why men don't want to seek medical help, because at first, time is very important to men. We are breadwinners. Most of men are breadwinners. I don't say that women are not breadwinners, but I'm saying most of men are breadwinners. And you see that if you go to the hospital, your whole day will be wasted. So these men will try to avoid, take temporary fix. I feel pain, I'll just go at the pharmacy and get antibiotic without getting prescription, or anti-pain without getting a prescription from doctor. Yes, temporarily that might help you, but what we need to do is, as much as you are working, you need to be true to yourself, even if you're youth or whatever. I'm not saying you should go to the hospital every time you feel like you have a problem, but put a schedule. You have time to watch movie. You have time to go out. You have time to do these very important things, but you cannot do those things if you're not healthy. So health is your biggest how do we put this? It is your biggest source of everything that you have. And that way, I would argue you to set aside some time. If you're young, at least once in 6 months, go to the hospital, and you don't just go there because you're sick, but just go to check. Okay, check your health, check your teeth, check your eye. Okay, your eyes, check the way how you hear. Okay, you can also, if you're a lady, okay, check that lady. Okay, get tested, check if you have any infection or something. So just go for a checkup at least once in 6 months. Okay, if you're not sick. And I would discourage. I'm among the doctors that if you call me, I sometimes receive up to, some days, in the most days, I would receive up to 200 calls for people. They'll just call me, doctor, I have this and this challenge. What do I do? Sometimes if you have a friendly doctor, or if you know someone, just call them and explain what you have. They will help you. We understand that we don't want to tell you to come to the hospital because we understand the environment. Some things are just simple. For example, just was a few days ago, I'm happy that I was privileged to save the life of a child who I didn't even know. I just received a phone call after my session on YouTube, a phone call that, doctor, my son is having 1, 2, 3. What do I do? So I just told that mama, thank you for calling. Put the phone down right now and rush this child to the hospital, and then we'll talk. So when she went there, they told her that if she were late, the child could have died. So it's just a phone call. I didn't ask her for whatever. It was just a phone call because she thought maybe she is fine, the child is fine. But sometimes it's very urgent. So call that. Have a friend. They usually say that you need to have a friend who is a health professional, who is a lawyer, from this different section. Like we need each other. So let's be friends. Okay, so that I can call you when I have a favor or something to request, and then you can also answer me, and we'll just do that. So even if the pharmacy is just right there, if it is the medication that you were not told by the healthcare provider, please try your best to avoid, because you might not know, maybe you are allergic to that medication, but because you're just used to it, your body is been helping you, but someday it might cost you. It's not that expensive, but you can make a very expensive mistake.
Right. Thank you so very much. I think today has been one of those wonderful, wonderful days of our lives here on Didiba, to have a very cheerful person like you. Maybe just some ways to the whole Didiba before we close. Can you get me?
I can hear you well, but I don't think people understood your question.
Okay. I think it wasn't really a question, but I think, like I say, it's been an honor to have you. So maybe before I go to closing, I just wanted you to share a few remarks, for the whole for the whole TD bar crew that was here and everyone that was here listening to you.
Cool. Thank you very much. So I'm actually privileged, and I'm happy. Today is Sunday. I just came from church. I'm a Christian, and it doesn't matter if you're a Christian, if you're a Muslim. We all have our nature or whatever we worship. That is fine. So to me, this is very important because this is it's a part of also a sacrifice, and I'm usually very happy to help and offer that hand. I was lucky to have studied and become a doctor, and I always want to use the knowledge that I have to support others. I always like to impact someone, and I know that I cannot change the world alone, but with your help, for example, with our host, the TD bar, and everybody, I am happy anytime when you have something that you want to talk about. I have accrued a lot of experience in different things that we can talk about, and even if I cannot explain myself, I might even able to connect with even other colleagues who can also, who maybe are other specialty who can also talk to my people here. And I would like to anyone who has joined our call today to be healthy and to avoid several things that they might have happened, but because you have listened today, I'm happy that you will change the way you are, and you will increase many years, and you'll be a doctor where you are today, and support someone and tell them what to do and support them. That will be the best gift to me ever, to make sure to see that other people are healthy, and we are striving ourselves, into becoming healthy and becoming rich, as we are still living in the world. So I'm very privileged to be here, and any time that you would need me to come, just DM me, just text me. The host has my number, but you can also see my channel with the same name, like Tariki Ganjani. I have some videos, information videos, over 1,000 videos, but they're in Swahili. But nowadays we have AI, it can also translate. There are information videos. You can pass by my account, even in Instagram, TikTok, YouTube, and listen to various health talks that I have provided. So thank you very much.
Thank you as well. So as we wrap up today, remember that knowledge saves lives, and every action saves even more. A heartfelt thank you to you, Dr. Ganjani, for your time, for sharing such valuable insights with us. For the passion that you've also shown us. One thing I've learned from you is that you're a very passionate person. I think I watched your live yesterday, and that was also breathtaking. Yeah, that was very nice. The passion that you have for your country. Keep on doing that. May God always keep you safe, protect you, so that you save even more lives. It's been a very great pleasure to have you among us. And like you said, this is not the last time. We're going to keep on having you. So thank you so much for that as well. So until next time, I just want to tell everybody that you should stay informed, take care of your health, and encourage those around you to do same. It has been a great time here from TD Bar and everybody else. For everybody that joined the live, we thank you so much. Thanks for listening. May you have a very good evening. May you, to others, it's morning, so also have a very good morning. Take care of yourselves. Be protected. We love you. We love your health. It's wonderful to see each and everyone healthy each and every day. When we come here, knowing that each and every member is healthy, it also something that makes us happy. So just be safe, stay healthy, take care of your lives. It has been me here, the event aura from TD Bar. We say thank you. Have a very good evening, good morning, and good afternoon. But yes, a prayer before we go.
Yeah.
Okay.
Awesome.
Edna, can you pray for us, please? Are you there? Phoenix, will you give us a prayer?
Yeah, sure. Okay. Let us pray. Father, we thank you. We give you all the glory. We give you the honor that we're here. We've been here, Lord. We thank you for the doctor that has come today. We thank you for the knowledge, oh Lord, that is given us, everything that is taught us, oh Lord, my God. We thank you that we've taken one or two, oh God, in our daily lives. We pray, may you help us, oh Lord, to be healthy. May you help us, oh Lord, to take the right path to protect our lives. Lord, the ones that are sick, oh Lord, may you touch them, oh God. And those that they've taken any knowledge here, may they go out there and help others and teach others. We give you the glory and honor. As we always meet, Lord, we thank you that you're always with us. You start with us and you finish with us. Those that are going on their way, Jehovah God, we pray that may you guide them, may you protect them in anything that I do. We give you all the glory and honor in Jesus' name we pray. Amen.
Amen.
Amen. Thank you so much, Doctor.
Amen. Thank you very much. Till next time.
Kusobano.
Ajalugu bempiro chizungu chokachoka.
Mwarulukira zakungambika zachichewa.
Ajalugu chizungu chokachoka.
Ake fresh chomwe kukwererana.
Ajalugu siningabe mpele mchichewa o chitumbuka sindi matai zichewa zimatawa chikakhala chitumbuka ndichovuta nde zimandivuta
Mano chikungo ndisangalatsa nchimodzi azibaye athu ose panopa ndova mulungu amaswa pemphero osati mwa masewera iyayi ose ndova mulungu ose Sheli Ndaji the event ora Edina mumatimangirira
kodi maona ngati ndifolowerera edi timadziwa tikhomola mulungu timaliziwa kuti ndili pati.
Masteni, Phoenix, Wanda, Aaron, Edna, and everybody, you continue having a blessed day. Stay safe. Bye.
Bye, event all. We love you.
Event. Ukusweka?
Today, okay. Today's conversation was one
John,
of the hardest.
Yeah,
anyway, bye.
Bye. Thank you.
Endi na wamana tawa vempero munamuona
Hey fresh. Conversation sana bili. Ndaji was kidding with me. We know again to come and kill him comment section.
Sheli, see. Zisiye. Tizilongosola pepa zisiye. Koma lero li conversation yake yabwino kwambiri guys ndipo tathokoza
kwambiri. Ndipo ndetaphunzira usati masewera.
Ayi guys tiyamikira zinthu zabwino. Today it was good and we have learned a lot and zimene ndaphunzira ineyo ndiuza swazi zange fwangati zana zija ndisangatsa za vaccination igeni
ndinanena atu mupemphero lija ngakhale mmangona ati pemphero lija linali la chizungu ndinanena kuti ambuye tithandizeni ndikapita kunjaku tikathandiza azizathu.
Straight up I'm going to my friends especially omwe ali ndi girl child
inani sindimadziwa ngakhala girl child ukhoza kwamupangisa vaccine imene chayo kuyamba atu
sindimadziwa inenso ndava ndipo ndi chomwe ndalemba choyambirira chimenechi.
That was nice, man. We've learned a lot. Even our matupi athu mwatofunika tizingokhala ndi glasi imodzi ukakhala wamkazi ukakhala wamuna maglasi awiri ba.
Amanena corona. amanena tu corona
ndeka ka glass ajalupa
wine or bottle
iwe tole daily so bano ukakhala kuti uzi mwa Friday roka ndekuti umwe wonse umene umayenera
kuphatikiza onse
uphatikiza onse
androiba kwambiri black and gold
ajalugo sumu na movie kujananena kuti wanena kuti biye ndi bottle
ine na mumva ati kuti biye komana nanga si wine
biye ndi bottle mozi komana wine bottle
aiza za wine sana nini mkudiwa zote
adisira mabuno deni iwo sana chimeji za wine
hiyo tu yatsobola
za wine
ndikuti kwa
hiyo yatsobola ya maboto awili imela maboto awili yatsobola kwa mashukanisa
adali bomba goma
edi nari miambe moa mufa ari miambe moa edi